Hey y'all. Okay, so I am getting ready to leave for my third round of Red Devil, but we are running super late. Grandma did a number 2 in her pants, so I had to take a little bit longer to change her. She's not good this early in the morning. Usually we wait till she wakes up on her own time. But so it's causing me to be 15 minutes late. So hopefully they'll still take me to get the chemo treatment. Last time I was running late, if you can remember when I said my video says I'm overwhelmed, I was about 20 minutes late because I had to use the bathroom and I had to stop at a gas station to do it. So it was an emergency. So I don't know if they're going to take me or not. But we're running super late and they only have a 15-minute or a 10-minute window to be late, so depends on how fast Mr. Christine drives. He's not even in the car yet, so I don't know. We'll see. We're starting the day off good. All right. I'll see you at the next step. Okay, so we're on our way to the hospital. We've got 20 minutes to get there. 20 minutes and we live 45 minutes, so we're gonna see how this goes. The worst case scenario is they just don't take me. That'd be the worst case scenario. They do have a 15 minute leniency, but the last time I was late, which was like a month or so ago, I was about 17 to 20 minutes late, and the front desk was basically giving me crap about it, and basically was saying that I wasn't going to be able to get my chemo treatment because, you know, I went past their limit. Yeah, isn't that nice to say to a patient that has cancer? Yeah. So, I've got my cream on for my port to numb it, and I mean I'm ready other than that. So what happened was, you know, I can't leave the house without changing Grandma. She has to, you know, she uses the bathroom through the night, so I just didn't feel comfortable leaving her. She has to be clean before we go, so but that's what you do. You gotta prioritize, and sometimes people run late, but we'll see what happens. So I will keep you posted, and I will see you when we get closer to the hospital. This is the third Red Devil treatment. It's supposed to be at each time it gets up to more and more. So this one's going to be a little more than what I had last time. And we'll see how it goes. All right. So see you all at the next step. Okay. And so I've got the cream in the port. And here is what I use, or what the hospital gives me to use, is this cream right here. And it's numbing cream for those of you who are new to the channel and are new to, or maybe have just newly gotten diagnosed with cancer. That's what the cream they give you to put on your port. I usually put it on, you know, half hour to 45 minutes before I get there, just so that it's nice and numb for when they put the needle in. So the port hasn't been used in a couple of weeks, so let's cross our fingers and just hope that it still works and it's drawing blood, because if not, they have to put some kind of chemical in there or something that will break up something crystallizes inside of the tube, and they'll put some kind of chemical in there that'll break it out, and then they got to pump it through. And you can feel it for sure. But so hopefully, cross our fingers and let's hope that it works today. So like I said before, this is my third Red Devil treatment. I went through 10 rounds of Taxol and a couple other, I forget the other treatments that it was, but this is the second part of my treatment, and I'm on the third Red Devil, and I've got one more left to do, and after this one. So 4 total, and my stomach's already upset because I don't want to do it, but I have to. So my stomach's already upset about it. So let's hope that it goes smooth. The boys couldn't come with us. They didn't get up on time. They went to a baseball game last night. Didn't get in till late because then they went and played pool. So they won't be here. But Mr. Christine's here, and we're running a little late. I've got like 2 minutes to get there. So we're just now approaching the turning where we can get into the actual, like the community where you turn to get in there. So I will see you all at the next step.
Yes, so.
She don't understand it. Half the time she asks me where she's at. So.
Yeah. Well, you're getting so close to being done. So
one more after this one.
After this one. Exactly.
Thank God.
So, yeah, you're so close. So.
What was the white blood cell stuff? Is there stuff way down still?
Let's see. White blood cells are good. Hemoglobin's good. Platelets are good. Yeah.
Good.
Everything looks good. Let's check your liver.
I do have a question.
Huh?
So when last time I talked to him, he was trying to say that depending on how the chemo goes, he could just take the pieces out and not remove anything. But I don't want to go through this again.
Sure.
So what is the best thing to do? Is it best to just take it off, or is it best to just do little pieces?
It's a good question. I think that it's more of a personal question, actually.
Well, I don't want to do this again. Yeah. So, like, what is the best
chances
thing to where you don't have to? I don't want to go through this again. I just don't want to.
You know, and I'd say that as well is that when we take out what he's saying is the lumpectomy, where they're just taking the cancer out and they're leaving the rest of the breast, then you automatically need radiation no matter what.
Okay.
That is equivalent in terms of how long people live, recurrence risk, things like that, to a mastectomy or taking the full breast off. So those options are equal to each other.
Okay.
Now, with the mastectomy where they're taking the whole breast off, then sometimes we can avoid radiation in those instances, but I would say in your case, with your type of cancer and the lymph nodes being involved, probably not. So you'll still do radiation, regardless. So it's more of a question of what do you want exactly, personally, really.
What's radiation like?
Radiation is like
same as chemo?
No, nowhere near the same as chemo. So, but I would say the main things with radiation is that it's Monday through Friday, every day, and you have to come back for, depending on how often they want to do it, maybe, 4, maybe in 5 weeks potentially, Monday through Friday. But each treatment's only like 10 minutes. So you're like in and out, but you have to come back a lot. So you guys live far, right? So that's going to be a lot on you guys.
What about the burns? Does it burn real bad, like sunburn or burn?
Yeah, so definitely some people can have some skin irritation and redness from the radiation as well, but most of the time it's fairly manageable for the most part. But mainly people complain of fatigue, really, just when they're on that. It's not like you're nauseous, it's not like diarrhea, all the other side effects from chemo, those are all gone.
Okay.
It's mainly just like fatigue, I would say, mainly. And then you guys are driving back and forth a fair amount. So one thing they may talk to you about is that since you guys live far away, sometimes they can consolidate the radiation a little bit more and give you a higher dose of the radiation, so that way you don't have to come back as often. So that's something that when you talk to them, that's something they'll bring up as well. Okay. Have you seen a radiation doctor yet or no? So we'll need to make that arrangement.
That's another doctor?
That's another doctor. Yeah, it's not me. So
Oh, man.
I know, but I have someone that you'll like. Her name's Dr. Castellini. She takes care of all our breast cancer patients. She's very nice. So,
Okay.
so I'm gonna send you over to her so that we can start talking about what the radiation plan is like. It all again depends on what we see on surgery. I know we've had this conversation before about you finish the chemo or you're so close to being done, then you go to surgery, and then depending on what we see on surgery, then if there's leftover cancer, then you need to do a chemo pill. And then in both scenarios, regardless, you still continue the Keytruda.
Okay. Is that the IV?
That's the IV. That's every 3 weeks
Ah.
still. So in either scenario, you're still getting the Keytruda after, and you're still seeing me and things after.
Okay.
Now, if there's no leftover cancer, then we go with the radiation first while doing this at the same time.
Okay.
If there is leftover cancer, then we do the chemo pill first, then you do radiation after that.
Oh my gosh.
So yeah, I know, right? So we really want no cancer left over.
Right.
So is the name of the game. But if it's not, it's okay. We can still work with it essentially. Okay.
Now, is Keytruda the one that was giving me the fever and the...
No, that's the Taxol medication that
Taxol,
you
that's
finished, that you're done with.
Okay.
Have that again.
Okay, good.
She's still getting Keytruda now sometimes, ain't she? That's what
Correct.
I-
Yeah, she gets it every 3
Is
weeks
that the
still.
P
Yeah.
word?
That's the P word.
Yeah,
So
okay.
yeah, so
I can't pronounce it.
Pembrolizumab.
Yeah.
Yeah. So yeah.
I just call it the P one.
Keytruda is easier for people to remember. So
P, the C, the...
P and the C drug.
Yeah.
So, yeah. But so the P drug is the one that you'll continue. So
Okay.
moving
It
forward.
was almost like he wanted to do the minimum and not avoid having the tubes. And then he
The
said, well,
drainage.
no matter what, you can still get the cancer come back anyway.
Correct.
But we were like, well, if you took them off, you wouldn't. But I guess it could go somewhere else.
Correct.
To
So
the
the-
lymph nodes?
Correct. So yeah, you can go in the lymph nodes and get out to other places. But we talked about a couple different things when he's saying that. So he's talking about what we call local recurrence. So basically, if you don't take the breast off, can the cancer come back in the same breast? Theoretically, yes. Anytime we take cancer out of just one area, it still can come back if you do a lumpectomy. Versus if you have a mastectomy, then there's no place for it to come back really.
Right.
But it could come back in the opposite breast as well too.
Right.
So when we say local recurrence, that means in the same breast if you have just a lumpectomy or the opposite breast. And that's different from what we call distant recurrence. And that is saying that the cancer comes back because of the lymph node, it goes to the liver, lungs, or somewhere else, becomes stage 4 as
Yeah.
a result of that. So that's what we call a distant recurrence. Now the chemo is really preventing both of those things, really. We're trying to prevent both of those things. Not foolproof, but it helps decrease the chances of both of these things happening.
What is the percentage that it travels?
Yeah,
Pretty
so
higher.
so I would say with having lymph node involvement, it's probably 20-30%, chance of it maybe potentially coming back locally or even distantly potentially. So the chemo's goal is to decrease that number, by about 10-15% or so, even more. This one, so that's why we do it
Yeah.
essentially. So especially in this type of cancer as well. Too.
So he'll go in there, and then just depending what he sees, if he's just doing partial, but if it's too much, then does he make that decision
Yeah. So
like during surgery where?
Well, so usually he'll try to make it before, and so what we'll do 18th now. So basically, what they will do is they'll do an MRI of your breast bilaterally to see how well. That'll sort of be the final. Sort of how we did the ultrasound halfway through.
Yeah.
The MRI is a little bit more extensive and looks at both sides
Okay.
and makes sure everything looks good, and that we're seeing an expected response from the chemo, and that there's nothing that's going to be surprising us there. Then after Dr. Gunther gets that information, then he talks about the type of surgery he would recommend.
So there's no
initially.
surprises.
So there's no surprises. So when he goes in, he knows what he's going to be dealing with.
Okay.
So yeah. And then you have a rough gap of about 4 to 6 weeks from your last date of chemo to the surgery.
Okay.
So you give some time off, you
Yeah.
relax, you don't do anything, no blood draws, no coming in here,
Yeah.
unless you want to come and say hi, but
What about
um,
this? Does this stay in?
that stays in. So yeah, that stays in because you're still getting the Keytruda through that. So
Oh, so through the 6-week break, I still get the Keytruda?
yeah, even through that break, the chemo's done still.
Okay.
So yeah, so the Keytruda will still continue every 3 weeks still. Yeah,
Okay.
but the chemo is done at
Okay.
that point. So yeah, good question. So good question about the MRI. So we get that scheduled before. I'm making the referral to the radiation doctor. It's not imperative that you see them immediately, just because their plan also depends on what happens in surgery as well. But they can sort of talk to you about like the nuts and bolts, the schedule of what it may look like, the side effects, things like that. So that way you guys can sort of start planning for that.
Yeah.
Just so you can get an idea of what it may entail. Does that make sense?
Yeah.
Okay.
Well, I'm hoping, maybe the chemo took care of everything, because
That's what I was
even
gonna
though I
ask
want
you,
to
so,
take
yeah.
just take the whole thing and just be done with it. My grandma, if I'm in the hospital, there's no one to take care of her, so I kind of have to make a decision on who's going to care for her too. If I have a draining thing and I have to stay in the hospital for a while, who's going to take care of her? I mean, hospice only comes twice a week, so
So you need
and they only change her once that day, and she needs to change more than that. So that's why I'm like trying to figure out like how I would, unless I hired someone, a stranger, which.
Give out recovery times between the 2 surgeries. So the lumpectomy is easier recovery time. You're not in the
Like a
hospital.
day.
Yeah, you go in and you're out the same day.
Yeah.
So you're not even staying in the hospital. For a mastectomy, he may keep you in the hospital for a day or 2, maybe even longer, potentially, on how well it goes and things like that. So, yeah, it's definitely something that think about that decision about what you want. And, with your type of cancer and where it is, no one is going to fault you for saying that you want the whole thing removed and you don't want it. So
I just don't want to have to go through chemo again. At all.
of course, no, definitely.
But
So,
I mean, who does? Right.
100%. So, it's definitely something. And then, he'll talk to you about, if you want reconstruction as well, then he will refer you to a plastic surgeon. And sometimes they, then it becomes a little bit more of a deal in terms of, okay, now we have to wait you have to get radiation at some point. So when can we do that? Do you want an implants? And how does that work exactly? So these are some questions I want you to ask, when you see him next time about, if you want implants, and how does that work with radiation and things like that. And he'll refer you to one of the plastic surgeons as well, too.
Okay.
But
do they do a plastic surgeon even when they just take pieces out?
so typically not, actually. He can actually see as well as he can to try to reform when he's in there, try to do as best as he can to keep the shape of the breast the same, typically. But
what about the armpit thing? Stuff?
Typically, when they're removing lymph nodes and things like that as well, with the surgery, things like that. Some people may have some swelling in the area after, but it usually gets better typically after. Got it. And we'll get a good look on the MRI as well too, actually. So
does that do the underarm?
the chemo
No,
or
the
MRI, yeah,
it will do
it'll,
the underarm
it'll
too?
see
both sides. 'Cause
both sides.
I don't think
correct,
this side was even checked.
Correct.
You got a 3D, don't you? They got a 3D one. Didn't see depth and all that.
What was that?
Don't you got a 3D machine down there that does a...
There's one, for the mammograms and things like that. But for the MRI, it'll see all the way down,
Okay.
very low on both sides, actually.
Okay, so I've got my medicine, my pre-medicines in. It's my nausea medicine and my steroid, and we're ready to go. I'll get Keytruda, the Red Devil, and something else I can't remember. So I will let you know at the next step.
I came that way, just stuck it instead of flying.
If I could only read your mind, then I could be the one you need. I'm really good at taking care of everybody else but me. Maybe if I act real nice, maybe if I smile real big, maybe I could change the shape of who I am till I fit in. I guess I lost myself trying to be somebody else. So I'll sing a song that only I can sing, a melody nobody knows but me. A million things I could pretend to be, but maybe the best thing I can be is me. Maybe the best thing, maybe the best thing, maybe the best thing I can be is me. If I ever show my face, nothing left to hide behind. Would anybody stay right here with me no matter what they find? It's easier to shut my mouth, it's easier to just agree, to put my heart inside a box, turn the lock and hide the key. I guess I lost myself trying to be somebody else. So I'll sing a song that only I best thing I can be is me. I have something to say, I can't keep it inside. The world needs more people who are truly alive. And I have a voice, and I have a name. This life is a gift, it's not a mistake. Oh, I have to believe I'm not a mistake. So I'll sing a song that only I can sing, a melody nobody knows but me, a million things I could pretend to be. Maybe the best thing I can be is me. Maybe the best thing, maybe the best thing, maybe the best thing I can be is me. Maybe the best thing, maybe the best thing, maybe the best thing I can be is me.
Okay, everybody, I just letting you know we are finished with our third Red Devil, and I slept the whole time. The nurse gave me some nausea medicine, and I slept the entire time, even through the Red Devil. So I didn't have to go through it. I was feeling sick to my stomach when I got there, so they gave that to me, and I was out like a light. But we are going to go now and check the P.O. box, and I got my white blood cell booster in my arm. It won't go off until 5:30 tomorrow evening. So I had to be really careful the dogs don't scrape it off. But just giving you the update, and I will see you soon. Thank you all for the love, the prayers, the support, the encouragement, and I'll see you on the next one. Love y'all.